Hello, my name is Tirthankar Deb. I'm a second year student and a fellow at Center of Digital Strategies at Tuck School of Business at Dartmouth College. I'm pleased to welcome Lindsey Baron, Senior Manager Product Operations at athenahealth. She's here as part of Brit Impact series in healthcare's new network. Lindsey, welcome to Tuck and thanks for being here. So Lindsey, let's start the conversation with more disruptions, please, and you can talk more about the partnership that you are having with other companies and entrepreneurs.
Sure, absolutely. So the name of the program, as you said, is More Disruptions, Please. And the premise that it was founded upon was Joy's Law, which states that the smartest people actually don't work for your company. So the idea is that we partner with companies and organizations, and they're at different stages of their life cycle, that fill product gaps for us at athenahealth. So we have our core product offering, but we also have the humility to recognize that we can't build everything fast enough for our providers in ways that they're looking for. And so what the program allows is for us as an organization to reach out to form partnerships with companies that have built capabilities that we would like to have, but we can't bring it to market fast enough to fulfill our providers' needs. So we have, I think, we have 8 different capabilities spread across 21 live partners. And what we do is we work with our product managers to identify which product gaps we'd like to fulfill. Then our business development team goes out and tries to find organizations to partner with. They vet the companies. We go through kind of a matching process to make sure that it's a good fit. And then we launch a beta process, which can last anywhere between 6 to 8 weeks. If it's the first company that we've partnered with within a capability, we will take a little bit longer. So that's the premise behind it, is to kind of fill the product gaps for athenahealth while keeping in mind that the clients have a list of things that they want us to provide. We can't ever provide all of them. Let's find companies that do it really well and use them.
Let's talk about electronic health records. There has been a lot going on about this. There are huge benefits to patient care, but at the same time, there are challenges. There are challenges of cost containment pressure, and there are government regulations also coming in. Can you talk more about how athenahealth is thinking about tackling those challenges and mitigating the concerns for providers?
Yeah, sure. So it's a great question, and I think as an industry, it certainly has a lot of barriers to entry because for a lot of people, it is cost prohibitive. The advantage for athenahealth is that we're cloud-based. So as we iterate our products and as we build new functionality, we update those changes to the cloud every night. And it's a seamless interface to the clients. So they don't need new software, or they don't need a consultant to come in and tell them how to update their program. We just do it automatically. So the platform is flexible enough to accommodate those changes, and we build towards that. So for us, the electronic health records is a big part of our product offering. It's one piece of many for us, and we feel like we really add value in being cloud-based because it allows us to be nimble enough to react to the rest of the government regulations and changes that are coming all the time. So it's a competitive advantage for us. It's a challenge for other people.
Lindsey, there is also a bit of privacy issue concerns with electronic health records implementation and usability. There's HIPPA regulation. Can you talk more about what athenahealth is doing there?
Yeah, so we take HIPAA regulations very seriously. As an employee of athenahealth, I go through training every year where I have to certify that I understand the HIPAA regulations and how that impacts my daily tasks and roles. Security at athenahealth, specifically at all of our sites, is very strict. We have ID badges that we wear all day. If you are on campus, you have to wear your ID badge. It has to be visible at all times. You scan yourself in and out of every room that you go into. You scan yourself in and out of every elevator that you go into. And we recognize that oftentimes the data that we're looking at, the real-life examples to try to improve things, are people's actual medical records, and we are looking at what a provider was helping to treat or fix. And so that obviously is held with the most strict confidentiality. And I can't go home and talk to my husband about what records I saw during the day. It also just isn't relevant. I mean, we're using the information as use cases to make the business model better. We're not necessarily concerned with the medical data itself.
Let's talk about how mobile devices are impacting usability of EHR. athenahealth last year acquired Hippocrates.
We did. Hippocrates was a big acquisition for us. I think it closed last March, and it really, in the beginning, at first blush, it doesn't necessarily seem aligned with athenahealth and what we do on a daily basis, but Hippocrates is the #1 downloaded app by medical professionals across the country, and it helps providers in the moment of service, which is exactly what we're trying to do, which is be providers' most trusted service. So at the end of the day, it was very well aligned. We also have partners that are mobile. We have a partner of ours called iTriage, and patients can go online and find a provider based on ailment type or location and find a provider in network. So we take very seriously that there are many ways to consume healthcare industry updates, and we need to be able to give patients that flexibility so that our providers can benefit from that.
What worries you a lot? Is it the government regulations, or is the pain in convincing providers about attaining the ROI on the investments that they make?
What keeps me up at night?
Yep.
It's a good question. So when I am kind of narrow-minded, what keeps me up at night is my role specifically, and since it is new for the company, it's like having a startup within a larger, well-established organization, which is the best way to be part of a startup, because you have all of the support and infrastructure of the big company,
Right.
but the pace and environment of a new company. And that's been really fun. It's been a very, very fast, hard 6 months. So that keeps me up just from a day-to-day running the operation perspective. I think that from a global perspective, when I can take a step back and look at where the company is in the context of the healthcare system within the country right now as a whole, I think what is most important for us, and I do think that we're doing the right things, is to maintain that creative thought leadership for impacting change. And so More Disruption Please is really indicative of how we're running the company. We started this because we believe that in order to impact change, you can't be insular in how you think. You have to ask other people for help. You can't be so siloed that you don't work outside your own walls. So having the flexibility to ask other people for their ideas and to work together in partnerships is really how to move things forward. And I think that more than anything is what's going to impact change in healthcare for the country. It's so institutionalized right now, and it's so bogged down in how we've been doing things. I mean, some of the things that we do are so archaic. It makes it harder for providers to provide good medicine, which was never the intent. So I think there is this kind of crossroads which is happening where we just want to get out of the provider's way and let them practice medicine. Our mission is to be the most trusted source. We want to help providers do that, and we want to allow them to focus on why they went to med school in the first place, and athenahealth can handle the rest of the things that they have to do in order to keep the lights on.
Any parting thoughts for our viewers here?
I personally joined the company 6 months ago, and for 10 years prior to that, I was not in healthcare, and I worked for an industrial supply company and the largest oil and gas company in the world, and I had no background in healthcare. And athenahealth didn't really care because we think that in order to bring change, you have to bring people who haven't been living in your world and have a different perspective. And so I would just encourage folks to believe in that and to believe that smart people can learn old things and then learn how to make them better. So don't be afraid to jump in.
Lindsey, on behalf of Center of Digital Strategies at TUC, I would like to thank you for being here, speaking to us and sharing your thoughts and insights. This has been Tirthankar Deb for the Center of Digital Strategies at TUC School of Business.